Hey folks, got something for you a little bit different today than what you're normally used to seeing on this channel. Coming up next on TacMed TV. Hey folks, my name is Steve and welcome to TacMed TV. On this channel we talk about tactical medicine, emergency medicine, sometimes might get into some disaster medicine, and we'll also get into some operational medicine, and sometimes we even do gear reviews. So if that sounds like something you're interested in, click subscribe and enjoy the channel. But today I've got something a little bit different that we're gonna show you today. Of course, I'm sure most of you realize it's been a while since I put a video out. Earlier in January, I had sinus surgery done. Now, if y'all remember from the nasopharyngeal airway video, I talked a little bit about some of my sinus issues that I have. And if you haven't seen that video, I'll put a link to it up here in the card for you guys to check that out. It's a great video on nasopharyngeal airways. But anyway, had a surgery. I had a septoplasty with a turbinate reduction and functional endoscopic sinus surgery, where I actually had some stents put up in here. And that was done back around the 1st of January. Recovery's just about done. I had my second post-op visit this past Friday, and the doctor was gracious enough to allow me to come in with my camera and a tripod and set it up, because I wanted to see, wanted you guys to see what I've what I've been dealing with, some of the recovery stuff that I've dealt with over this past month, getting ready to shoot this video. Okay, so I want you to see, because the whole time I'm thinking, oh man, I'm going to put this on YouTube. I want you guys to see this. Now, we'll tell you, it is kind of gross, because what it is he's basically scoping my nose, and he's going up in there and he's pulling these stents out. Okay, I get a little loud. It's a little uncomfortable, but well, you'll see in the video. So let's go to that video right now.
All right. So I'm gonna look in your nose.
All right. Oh, this is gonna suck.
Yeah.
I need to
Suction.
grab some tissue too.
That sucks. Okay, you can kind of see there in my nose, and that's part of the stent, I believe, that he's pulling out there. Of course, all that other icky stuff.
That's your stents already starting to work that itself out.
Oh yeah. Oh yeah. This was not very comfortable for me, as you can imagine. You can see it's a little red in there, and there he is pulling the stent out.
Oh, just yank it out. Oh, wow.
Oh yeah, that was not comfortable.
Is that the stent?
Like that.
Oh.
Yeah, that's a little bit uncomfortable there too. He goes in there and starts suctioning some stuff out, and kind of cleaning that side out just a little bit. Ended up getting that blown out of my nose later.
Thank you.
Looks great in there.
Does it do
That side is
well, I'll see it here in a minute.
Trying to keep good spirits about it though, but it was rather uncomfortable.
Oh. Oh. Ow, that's so uncomfortable.
Yeah, that's kind of icky. I know it is. It's I'm sure that's what everybody wanted to do, was to see inside my nose. But I thought this would be kind of interesting for you guys to see. You know, a lot of that is just because of the buildup of the stents, because it is a foreign body that's in your nose, and of course, you know, the body's kind of like, hey, wait a minute, this isn't supposed to be here, so we need to get that out. And you can see he's clearing out some of the other stuff that's going on there. Ugh. this was really uncomfortable. It was just not. This was not a fun time at all. Yeah, that's looks like we've got the stent there. He's trying to get a hold of it. This side, it actually on that side of my head, the stent actually kind of broke up a little bit. He had to took him a couple of tries to get it out. And there's the stent coming out. Well, part of it.
So this one's breaking up. So
Well, I thought it was supposed to dissolve in there.
it does.
And this was uncomfortable. But again, judging from the response I got from the nasopharyngeal airway video, you guys don't mind seeing me be a little bit uncomfortable, and I'm okay with that. You know, this was something that actually it is markedly helped my breathing tremendously. Just already, I've noticed that it's so much better than what it was before. I mean, I can tell a huge difference. And there he is getting that stent out, and he just about got it. I think I have to sneeze. Oh yeah.
I think it just came
And if you notice in this video, I also have hair. You know, this was I had gone pretty much the whole month without cutting my hair. I just wanted to see what it looked like, and making sure we're getting all this on camera here.
Not so much focusing on me, but getting the scope.
Maybe you can do some audio edits to this.
Yeah, this was, here we go. Oh, well, almost. Just about ready to go back
You want a
in
little
there
more
and
numbing
get the
medicine?
stent out.
It's probably more.
And well, it's probably I've probably hit areas you couldn't get medicine because of the.
Yeah, hit me up with some of that.
Yeah, at this point he was being very generous and gave me some more numbing medicine. I don't know if it was Cetacane or what exactly it was they used, but man, it helped a whole lot once he did that, because he had removed so much material that the prior numbing treatment didn't get to, you know. So it was really, it made it a lot better after that.
Alright, let's go back.
Get this.
So now we're getting ready to go back in there. We're going to get this stent out.
Where I need it.
That left side. The left side was, to me, was the side that I had the most trouble with breathing. And when we reviewed the CT, oh yeah, there he goes. He's got a hold of it, pulling it out. Oh, and this looks nasty when it comes out. Oh wow, ick. You can see that huge thing was what was left of the stent. That right there was what was left of the stent. That's just icky. Ugh. Man, I was glad to get that out of my head. Just immediately, as soon as that came out, I could already breathe a lot better. Of course, you still, if you get in there, you're going to see that there's part of the stent. See it right there, that little piece right there. And he's going to suction some of that stuff out. And he's going to get that piece of the stent. Oh, got a little too far back. Engaged my gag reflex.
Hanging out by its long.
You all know what that looks like. You've seen the other videos.
Like a little fish bone.
So, alright, he's going to get that. Yep.
Ow.
Right there.
Alright.
Alright, now, one quick second. I need to do a curve
Now he's
suction.
talking about doing a curve suction.
This is not typical, but we will. That one up. I'm going to go into the left cheek sinus because you got a bunch of old blood in there.
Okay.
And I'm just going to go in there and just, it may not even come out, but I'm going in there and just vacuum you. You're going to feel like I'm pulling your teeth.
Oh, great. Yeah, that's cool.
Yeah, that's him telling me it was going to feel like pulling teeth. And I was like, oh, great. It's wonderful. And you can see in there where he's removed a lot of the material. Looks like the ethmoid sinuses and stuff that he's kind of removed, opened up. Not to mention what he did with the septoplasty, moving all that stuff around.
I-
All right, folks, that was the journey inside my head. Like I said, my second post-op visit where they removed the stents. He did tell me, I don't know if you could hear in the video, he said everything was healing up nicely. I can tell a huge difference in how I'm breathing. Breathing so much better through my nose now. And of course, the reason that I had this done was because as far back as I can remember, I've always had problems with my sinuses and had sinus infections 2-3 a year anytime the temperature changed. And I just got sick and tired of having to go to the doctor to get treated for that and missing work and all that kind of stuff, you know. So finally made the decision to go see an ear, nose, and throat doctor, an ENT. And this physician, his name is Dr. Brad Morris. I cannot recommend him highly enough. He was fabulous through the entire process. He's very personable, very easy to talk to. He listens to what the patient has to say. He gives good information and he answers the questions very well. He doesn't leave any question unanswered. If you've got a question, he's more than happy to answer it and explain it in a way that anybody can understand it, even somebody like me, just no paramedic. So with that being said, folks, if you have sinus problems, I highly urge you to get out, find an ENT, get an opinion. You know, find out if there's something there that they can fix, because the technology today is such that it's so much easier. I think I was in surgery for maybe 2 hours, 2.5 hours, something like that, and it was general anesthesia. I was intubated, and I was out for that. But really the recovery, you know, I'd talked to some people that had had similar sinus surgery done in the past, and they talked about how very painful it was. And it was painful. It did hurt. My nose did hurt. It's actually still just a little sore. But it wasn't near as bad as I thought it would be. You know, I had it hyped up into my mind that it was going to be so much worse than it was, and it really wasn't as bad as I thought it was going to be. It was more of an uncomfortableness than it was a painfulness, if that makes any sense whatsoever. Now, I did take my pain medication like I was supposed to. I had the 5 milligram hydrocodone with the 325 acetaminophen in with it. And that did perfectly fine. It kept my pain under control, and it was managed well. And within 3 days, I had already moved to either Tylenol or ibuprofen. You know, acetaminophen or ibuprofen is what I had moved to, and I didn't have any problems after that. The biggest issue I had with it was for the first week, you absolutely could not blow your nose. And that was driving me kind of batty, I'll be honest with you. Sleeping the first 3 nights was practically non-existent. I'd take, you know, maybe an hour, 2 hours at a time, and I'd wake up because I'm breathing through my mouth and everything would get so dry, and then you'd wake up and you'd have to have something to drink to try to wet everything back down. So that was kind of uncomfortable. But after that 3rd day, it started getting better. Now, as far as my recovery went, everything was going good until the 2 Wednesdays after surgery, a week and a half after surgery. I ended up getting the flu with 102 fever, and of course that slowed everything down. That slowed down getting videos out. That just shut me down for about a week. The flu's bad this year. I know you've heard people talking about it. It's been in the news how serious it is this year, and I've even had a flu shot. But it's not they didn't get the right strain this year apparently. So anyway, went through that, and now I'm feeling at least 85-90% of normal. I'll be going back to work in another week, and you know I'll be good to go. Breathing very well, and everything's worked out fine with it so far. I've got one more visit. They may scope it again. If we do, if he does scope it again, I'll have another video on it, another follow-up to this. But again, I really would like to thank Dr. Brad Morris and his staff, all the folks that were in surgery that took care of me, the nurses in pre-op and post-op, the office staff at Dr. Morris's office, everybody's just been fabulous. Thank you guys so much. I really appreciate what you've done for me, especially you, Dr. Morris. I can breathe a whole lot better now, and I really appreciate that. That is something that I've dealt with for as long as I can remember, and I can honestly tell a huge difference in how I'm breathing, and I owe that to you. Thank you very much. So with that being said, folks, I hope you kind of enjoyed this little video. It's went a little bit longer than I expected it to, but it's a little bit different than what we normally do here on the channel, and it kind of gives you an explanation of where I've been for the last month and a half, 2 months. Okay, so anyway, with that being said, thank you so much for watching the video. Thank you so much for watching the channel. I really appreciate it. If you guys have any comments, questions, concerns, or complaints, please put them in the comment section. I'd love to hear from you. That's what makes the channel better. Tell me what you like, tell me what you don't like, okay? And with that being said, I'll sprinkle some videos around like I always do. And my name is Steve with TacMed TV saying stay safe.